So now our gel has been soaking for 45 minutes in the transfer buffer. We're ready to put together our sandwich. One of the things that I always emphasize to my students is never try to do this protocol without the protocol sitting right next to you, because if you put it together wrong, it will not work. And I did this when I was a grad student, so I know if you try to wing it, it will not work. So you are never too smart to have the protocol right next to you. So having soaked our correctly sized membrane in buffer, having soaked our gel in buffer, our fiber pads, and our correctly sized paper in buffer, we're ready to put it together. So now it says you're going to open the gel holder. So normally the gel holder looks like this, and you can open it by sliding the latch up and opening it just like that. And we're going to start by putting it together on the gray side, the dark side of the holder. So it tells you you're going to place a pre-wetted fiber pad on the holder. After you finish putting the fiber pad on top, then you're going to take your filter paper and put your filter paper on top of your fiber pad. After that, it tells you to put a pre-equilibrated gel. That's what we've been doing with our gel, is equilibrating it on top of the filter paper. If you have two of them, you need to put them exactly side by side, because two half gels will make up one gel, and they will perfectly fit your pre-cut PVDF membrane. But if you only have one gel that you're doing at a time, you can put it anywhere in the middle as long as you have your PVDF membrane on top of it. So here we have our gel on our filter paper. Now you're putting the pre-wetted transfer sheet on top of the gel. You don't want to get bubbles in this. So what you do is you bend it before putting it down. So you're bending it and putting it down on top of the gel, and you're getting rid of any bubbles. You need to get rid of any bubbles because air does not conduct electricity. So if you have a bubble in there, wherever you have a bubble, you're going to get proteins that will not transfer over. So after you have that PVDF membrane properly placed on top of the gel or gels, you're going to put another sheet of your paper on top, and then another pre-wetted fiber pad. When you have all that assembly put together, that's your sandwich. And then you're going to slide the lock it all together. And then you can put it in your, right here, you have electricity that will travel from one side to the other across. Remember when we did the SGS gel, we were separating our bands down, but now we have our gel next to our PVDF membrane. So now we want the electricity to travel across. So what you're going to do is you're going to set the black side to the black side so that you're doing this correctly. Slide it all the way down. Then you're going to hook up the lid, just like you hooked up the lid before, red to red, black to black. And you're going to plug it into your power supply. When you have it plugged into your power supply, you're going to transfer for 1 hour. After you transfer for an hour, you can take apart your sandwich. You can peel off the Western transfer blot that you have done here. And that can even sit in a drawer dried out overnight. And you can do the Immunblot portion of it the following day. The only thing you have to do is you have to make sure you re-equilibrate it in buffer before you try to add any antibodies to it. Last time we had the nitrocellulose piece that was next to the gel. We transferred all the proteins onto the piece of nitrocellulose, and then we can just take it apart and lay it on a piece of paper towel overnight. To do the Immunblot, the first thing you need to do is rehydrate that piece of nitrocellulose. And as you can see, it's floating on top of the TBS solution right now. So we're trying to push it underneath the TBS solution. and it's going to have to rock for about 20 minutes or so to rehydrate it in that TBS solution. So now we've had our Western blot soaking in the TBS solution. Took about 5 minutes, maybe 6 minutes for it to completely become soluble again in an aqueous solution. And now we're going to pour off all of that extra TBS that it was soaking in, and we're going to add our first solution. So our first solution is BSA. It's 1% BSA blocking solution. And you'll recall from the lecture that the purpose of the BSA blocking solution is to fill all those available spots on the PVDF membrane with protein. And that's also the reason why when I'm touching it, I'm not using my fingers. I'm specifically only using tweezers or touching it with gloves, because the PVDF membrane will bind to any available proteins, including what's on your fingerprint. So if you touch it with your finger, you will leave a nice big fingerprint in the middle of that PVDF membrane. So in this case, we have transferred our protein of interest to the PVDF membrane, and we want to fill all the other available spots with protein, because the next thing that we're going to be doing after the BSA blocking solution is we're going to be adding our primary antibody. And remember, the antibody is made of protein. So if we did not block all of our available binding spots for proteins, our primary antibody would just glom on all over the PVDF membrane, and it would not be specific at all. So by having all the other available spots bound with BSA, and then we still have our protein of interest, our aldolase, on the surface, when we add our primary antibody to this, it will only be binding to the aldolase. So remember, our primary antibody is rabbit anti-aldolase, and it was made by injecting aldolase into rabbits to induce an immune response in the rabbits. And this was done several times so that they had lots of circulating anti-aldolase antibodies in their blood. And then the rabbits were bled, all the red blood cells were removed, and the serum, which contained the antibodies, then became our solution for our primary antibody. So it's polyclonal. There are other antibodies in there as well as our anti-aldolase antibody. So there's always some potential for cross-reactivity. So you want to keep that in mind when dealing with primary polyclonal antibodies. We've had BSA blocking solution on here for 30 minutes. We can just pour off that solution, and we can add a rinse solution of TBST, removing a bunch of excess BSA from here. So we're just going to let that rock for 5 minutes, and we're going to do this twice. So adding some TBST, pouring it off, adding some more TBST, and pouring it off again before we add our primary antibody. Okay, so we've done 2 washes with TBST, and now we're ready to add the first antibody solution. Our primary antibody is rabbit anti-aldolase. So it will bind anywhere on our membrane that there is aldolase. Now we wait for 30 minutes. So now the first antibody has been rocking with our PVDF membrane for 30 minutes, and we're going to wash off all the excess. So we're going to add TBST. TBST stands for tris buffered saline with tween 20. And tris buffered saline has a little bit of salt in there to reduce aggregation of the proteins. The Tris is just a buffer to keep it at a good pH, and a small amount of tween 20 as a detergent, again, to reduce non-specific interactions of proteins. So by rinsing twice with TBST, you are removing any of the primary antibody that is not strongly bound to the antigen that it is specific for, which is our aldolase. So basically, we're going to wash with TBST twice, and then we're going to add the secondary antibody. So now we've done 3 washes with TBST, and we're going to pour off the last TBST rinse, and we're going to add our secondary antibody on top. Our secondary antibody is goat anti-rabbit. And so this was made by taking rabbit IgGs and injecting them into a goat. And so then the goat had the immune response against rabbit IgGs. So it will react with any rabbit IgG. So our primary antibody, remember, was rabbit anti-aldolase. So we have a rabbit IgG in there. And our secondary antibody is goat anti-rabbit. So now we're going to rock this for 45 minutes to allow our secondary antibody to bind to wherever the primary antibody is. And in this case, it's important that we have a secondary antibody, because with our homemade anti-aldolase antibody, we have no way of detecting where that antibody is binding. But our secondary antibody has a little protein tag on it. It has an alkaline phosphatase tag on it. So our secondary antibody of goat anti-rabbit with its alkaline phosphatase tag, when we add substrate for the alkaline phosphatase, wherever that secondary antibody is, it will turn purple. If you are lucky enough to be using a primary antibody that already has a tag on it, if you're using something that's very common, let's say you're using an anti-flag antibody, which is just a certain epitope, and the companies make an anti-flag antibody already with the alkaline phosphatase on it. In that case, you don't need 2 antibodies. You have one antibody that will bind to your antigen that can be seen by putting a substrate for alkaline phosphatase on there. And again, alkaline phosphatase is not the only thing that you can use to mark where your antibodies are. There's horseradish peroxidase. There is another one which causes luminescence when you add a particular substrate. Different companies come up with different solutions to the problem. The first company that comes up with it trademarks it so that nobody else can use it. And then the next company has to find another solution. So that's why we have multiple different ways of seeing where our antibodies are. So you just have to know what system is your particular chosen antibody using so that you are using the correct substrate. Because if you put the substrate for horseradish peroxidase in with an antibody that has alkaline phosphatase tag on it, nothing's going to happen. Our PVDF membrane has had the secondary antibody solution on it now for 45 minutes. We're pouring that off. We need to get rid of any antibodies which are not firmly adhered to our primary antibody. So we're going to be washing with TBST several times to make sure that we have all the excess off. So putting on TBST, waiting 5 minutes, pouring it off, putting on TBST again, waiting 5 minutes, and pouring it off. So now it's been washed twice with TBST to remove all of the excess secondary antibody. And now we're going to add some TBS to it because tween 20 inhibits the alkaline phosphatase reaction. So we're just adding some TBS for 5 minutes, and we're going to allow it to sit on our membrane for 5 minutes, and then we're going to do a color development solution. So now we've had our Immunblot soaking for 5 minutes in TBS, and we're going to pour off that solution. And now we're ready for color development. We're going to put our, it's called Western blue substrate. We're just going to put our Western blue substrate on top. And we're going to let that color development happen. Takes about 5 minutes, and we will show you what it looks like after the color develops. So now the color has developed. We can see the location of the darkest bands. That is where our aldolase is. You may see some spurious bands in there as well, because remember we started with a polyclonal antibody, so it may not be only a single band, but our darkest band will be where the aldolase is. To stop the color development solution, you need to put it in water, and after water for a couple minutes, then you'll be able to take it out and get a good picture of it.